Good morning. Today we'll be talking about determining the best fertility treatment option for you and your partner. Good morning, Dr. Toyin and Dr. Tambari. It's a pleasure to have you, Dr. Toyin, back with us again today on the program.
Morning.
Morning. Morning. So, Dr. Tambari, if I can start with you, can you tell us about fertility? What are the common causes of fertility problems here in Nigeria?
Okay, so when we speak about infertility, we're talking about a couple who have been having regular unprotected intercourse for up to a year and have been unable to achieve pregnancy. We have factors relating to the male, and we have factors relating to the female that could cause fertility challenges. And these are almost, equally split between both parties. In Nigeria, we see a lot of secondary infertility. So we could have primary, where there has been no pregnancies before, no conceptions before, and then we could have secondary, where there's been, conception before, and subsequently there are challenges achieving pregnancy. Now, looking at our healthcare system, the dearth of healthcare facilities or good healthcare services in the, local regions, that could contribute to the rise of secondary infertility, because we see that delivery practices are not as fantastic as we would like. When we look at the potential causes now across board, for the men, we'll be looking at issues relating to their sperm parameters. And these could be things that maybe they're born with, so genetic, or these could be acquired along the way from either infections or from lifestyle, sometimes from things we call varicocele, which are treated surgically. And you could also have unexplained issues. So a lot of men have issues that we cannot explain.
Now, if I can just jump in there. There have been a lot of studies, and some recent studies have come out showing that there's been a dramatic reduction in sperm count in men. Can you tell us a bit more about that?
Yes, so looking at the study that was done recently by a couple of fertility clinics, we actually studied men who had been reporting at these clinics and their semen parameters from 2010 to about 2019. And we see that when we look at the main parameters, like the semen volume, the sperm motility, the sperm count, and the sperm morphology, that's the form of the sperm, we actually see that there's been massive drops in these parameters. So for instance, if we're looking at the total sperm count, we find that for men, you actually have a decline from about 25.5 million to about 2.3 million between 2010 and 2019 in average. And when you're looking at the sperm motility, you're actually seeing a decline of about 38% to about 5% motility. Now, to put that in perspective, you want to have an average of about 15 million sperm in one male for a man, and you want to have about a 4%, 32% motility for the same man. And so if you're looking at a 5% motility, that's actually a really low, motility, and the sperm might not be able to get to the egg in time. And if you're looking
that's very alarming.
Yes, it is.
And this is just in what, 10 years?
In 10 years, yes.
Now, I mean, I don't want to digress. I know we're talking about other things, but so why? Why are we talking about this? What could be perhaps the cause?
Well, it's a bit difficult to say. We know that we look at things like lifestyle, which could actually affect cellular function, because when you look at things like alcohol use, maybe drug use, and general, health of, men or women generally, because of environmental pollution and all that, which causes what we call oxidative stress from toxins. This could actually be things that contribute to these poor parameters, climate change. So it's a bit difficult to say particularly what. Yes.
Anyway, I know we're going to be talking a bit more about you having a webinar to discuss some of these issues a lot more in the future. So if you can just carry on talking, you've talked a lot about the men. If you can talk a bit about the women, and then talk about some of the options and things that, and talk about, just talk about the women's issues, and then you can go on to talking about options that
Okay.
perhaps we will be able to get into in more depth at your webinar.
Okay, so for when we look at causes of female infertility, generally you want to ensure that the woman is in good health. So you don't want somebody who has a systemic disease that is not controlled. So things like hypertension, diabetes, or endocrine diseases like thyroid issues, these could potentially affect fertility. And so you want to make sure that the woman is healthy. You also look at her reproductive system. You'll be looking at things like the ovaries, where the eggs are stored. You want to know what is her current egg reserve. We know that women are born with their total egg reserve, and over time, the numbers reduce, but the quality also reduces. Now, you could also have environmental factors or certain medical conditions which contribute to, a more rapid decline or in quality or quantity of these eggs. And so potentially, these could affect the woman's fertility. From 35, we actually say that the woman's fertility is declining much faster than it has before. And so her chances are really reducing after that time. Now we look at the fallopian tubes, which are the channel between the body of the uterus and the ovary. So usually this is where the egg and the sperm would meet. And you want those fallopian tubes to be open. If the fallopian tubes are blocked, then you would have challenges with the egg and the sperm meeting. Now we have two. So if both of them are blocked, then there's no way for the egg and sperm to meet. But if only one is blocked, the second one could potentially function in the stead of the other one. Now the uterus itself, which is where the baby is carried, could have issues. And so we want to find out if the woman has a healthy uterus, whether we have common things like fibroids. You know that fibroids are very common in Black women. And so do we have fibroids? And if there are fibroids, do they require intervention? Because you want to be sure that the uterus is as clear as possible to accommodate that baby. You also want to look out for things like adhesions, which are scar tissues, which could potentially affect the inner lining of the uterus, which is very delicate and needs to be intact for healthy implantation of the fertilized eggs. So we look out for things like that as well. You also look out for other medical conditions like endometriosis, which is a condition that can potentially affect the gynecological reproductive system and can make fertility difficult. Sometimes a lot of Nigerians like to talk about infection, and a lot of the times those infections we're looking at can potentially cause the scarring that I have talked about. And so this is why we might be looking out for things like infection. Now you also want to look at the sexual behavior of the couples, because we expect people to get pregnant, but the truth of the matter is some couples are not having sex. So if the man is in Malaysia and the woman is in Nigeria, then there's not going to be any pregnancy. Or some women have vaginismus. There's actually pain trying to get in, and so you cannot successfully penetrate. And these are issues that might not.
I think one of the things you just brought up is actually that is taken for granted when people are actually discussing issues, and it's important to actually emphasize that needs to be taking place, because it's interesting when we talk about treatment options, and because it would actually be, why don't you try having sex in the first place, as opposed to just coming for treatment, So that's just one of the things that I think it's very good that you emphasize. Thank you.
Thank you, Pamela. So basically, we need to make sure that the couple is doing everything that they need to be doing. And then, we would take into consideration their own history, because every couple is unique, and then find out what the potential issues are. So they'll have a consultation with the doctor if they come into Bridge Clinic, and we will talk about what their issues are, how long they have been trying, and then we do basic investigations, or we do a comprehensive set of investigations, which will give us further insights into their problem. And then that would guide us to what kind of treatment to recommend. So like I said,
okay. So I think that it's important that we you're going to do that, but I know you're having a special webinar. You normally have a welcome forum, Dr. Toyin, and this time we're having a special one. Can you tell us a bit more about it?
Yeah, sure. So on the 16th of September at 10 o'clock in the morning, we're having a virtual, so like a webinar on Zoom. All right. And this is really open to everybody who is concerned about their fertility, has questions about fertility, is considering, some kind of fertility treatment. So it's really open to everybody. And it's really
Can I
just
ask a
for us
question
to,
though?
yeah, of course.
We need to ask, is it only people who are interested in fertility? What if I am interested in my child's fertility? What if I'm interested in my friend's fertility? You know, there's some people, you know, we are concerned for them. They don't appear
That's true.
concerned as
That's
we
true,
think
yeah.
they should be, particularly as time is, you know, galloping on. Can anybody attend this, or do you have to have a problem to be able to attend this webinar to learn more about it?
No, so you know, anybody who just wants to get educated or have more awareness is absolutely welcome to join. So all those different options you gave. So maybe your sister or your friend at work has been complaining about this and that, and you want to find out for them. Absolutely, come and join the webinar. It's free. You know, and it's just for us to really just, you know, have a good chat about all the different options, similar to what Dr. Tambari was talking about. You know, what the challenges could be, how you go about finding out if you've got a problem, getting information, and then obviously what are the potential options available based on what we find, you know, after you've seen us in our clinic. So we're very, very keen for as many people to join, because, you know, at the end of the day, you know, awareness is actually the first step in everything. A lot of people are just not aware of, you know, what could, you know, if there's a problem, what could be the cause of the problem.
Will there be a freedom for people to ask questions?
Absolutely. People can put their questions in the Q&A, and then our doctor who is running the webinar will definitely ensure that we can answer every single question on that in the Q&A. And then, you know, if people have extra questions, or if people actually want to come and you know, speak to somebody, you know, after the webinar, you know, we'll let them know during the webinar how they can contact us either by phone, by email, or by WhatsApp to get further information.
Thank you. I think Dr. Toyin, Dr. Tambari, this is this issue of a webinar, I think, is a virtual one that is actually very, very, should I say timely, because people have, you know, a lot of challenges, and people have a lot of issues, particularly with confidentiality. How are you going to make sure that the confidentiality is maintained on the webinar?
Yeah, that's an excellent question, because just like you said, a lot of people, you know, don't want to come out and be associated with infertility or fertility challenges. So definitely when when people are registering, you know, you're not going to have to put your full name. You can just put your initials, so that when you're asking your questions, you know, in the Q&A section on the webinar, it'll just be initials that are showing, and therefore you can really feel free to be as open and as honest and as vulnerable as you really need to be, because obviously what we're trying to do is to answer all those really pressing, maybe embarrassing, maybe concerning questions, you know, that you feel that you may have, without any, you know, without you feeling in any way that someone's going to judge you, or somebody else might know you on the webinar, you know. So we're going to really just ensure that we have that in place to really, you know, give a really robust discussion and be able to really just address your anxiety and your issues.
No, I think, you know, we're here, but I think the bottom line is that, you know, with the challenges that are happening, particularly, you know, the things we talked about the male sperm, we talked about the female issues, we haven't even talked about the societal challenges. But luckily, you know, the issue of the kind of treatments that are available, I don't know if you want to mention one or two of them, and how the webinar will be able to help people in determining which way to go.
No, absolutely. So, you know, like Dr. Tambari mentioned, one of the common causes that we see in this part of the world, in Nigeria, is secondary infertility. And when it comes to the women, you know, one of the big contributors to that is issues with their tubes. You know, and if your tube is blocked, your fallopian tube is blocked, there's no way you can spontaneously get pregnant, because there's no connection, there's nowhere for the sperm and egg to meet. So if, you know, a test has shown that both your tubes are blocked, then the only option really is IVF, right, which is in vitro fertilization, which is essentially us, you know, taking your egg, taking the sperm, you know, and doing that meeting in the lab as opposed to that happening, you know, in your body, which is the natural thing that would happen. So the good news is that there's definitely, you know, a way forward. You know, so blocked tubes doesn't mean you're never going to be able to have your own child. All it means is there's a different process for you to have your own child, which is IVF. Now, then, if we look at the male side of things, you know, unfortunately, you know, like we said, you know, the sperm parameters are so much worse compared to 10 years ago. You know, this is a real challenge. But again, there's hope, because there's something you can do about it. Now, normally a sperm needs to be able to move well and also move in a forward direction, to try and find an egg and fertilize an egg. But if you've got, issues with sperm movements or the way the sperm looks, that's going to reduce those chances of happening. So how do we avoid that? So part of IVF is a specific technique where you basically take one sperm cell and you inject it directly into the egg. All right, so you're sort of removing the need for the sperm to swim, to move, to search, to find anything. You take a sperm cell and you just inject it directly into the egg. And that's something called ICSI. And ICSI has really been really revolutionary in helping particularly male infertility. Because like I said, you just need one sperm, and that one sperm will be injected directly into the egg, and then you hope the fertilization takes place and that embryo gets sort of nurtured and cultured. So these are some of the options that we have for different issues that might happen. Another thing I wanted to mention actually is, again, in this part of the world, we know that certain hereditary diseases are a really, challenging problem. So sickle cell disease is a big, big thing, that we know is very common in us Black Africans. But again, there is hope. You can have a sickle-free family. The trauma of having a child that's sickle cell, all the challenges that go with that, all the health challenges, the risks to the child, the lifespan that's affected. Something called PGT can actually help. So PGT stands for pre-implantation genetic testing. All right. Now you need to do IVF to do PGT, but what you're trying to do, you're trying to basically select an embryo that doesn't carry the gene for sickle cell disease, and therefore the child that will come from that embryo will not have sickle cell disease, will not be a carrier, will not pass it on to further generations. So it's really fantastic that this technique is there, and we offer that at Bridge Clinic for couples. So maybe, you got married, maybe you weren't aware that you both carried a sickle cell trait. I do know that nowadays, they're part of the whole church counseling tends to be, let's go do your genotype, find out what you are, but obviously, love is love, and sometimes, AS and AS want to spend their lives together. And the great news is they now can spend their lives together and have children that don't carry sickle cell genes. That's really fantastic, especially for our community.
It is indeed. I know some couples who, lives have been really shattered by the fact that they couldn't come together. Now, in the past, now, one of the things that is happening is with women's career and all those kinds of things, they're not getting pregnant on time. And this whole issue of egg freezing, when you're talking about an option, because there's single women out there, and they're thinking, what are my options? Do I have options? Even as a single woman, what are my options? What can I do? So things like the egg freezing, is that a treatment option? How do you view that? Is that, how do we, and also for older women, are these some of the things that we can, sort of dig into at the webinar?
Absolutely. We're gonna cover all that, but just like you said, we're in a time when women, it's not like it was when by the time you're 21 you're married. Mr. Right is unfortunately not always around the corner, and then also you're also trying to get your career sorted out. So egg freezing, or sorry, you might have heard it referred to as social freezing. It's all about freezing your eggs. All right, and like Dr. Tambari said, us women are born with the total number of eggs we're ever going to have, and that decreases over time. But obviously, if you're not yet ready to have a family, or you've not yet met the person you want to have a family with, you can come and freeze your eggs, which is great. So it doesn't interrupt what you're doing. Your career carries on. All right. So you have to do an IVF process to collect the eggs, and then the eggs are kept for you, stored and frozen. And then whenever you're ready, maybe 5 years, 7 years, 10 years later, maybe you've now met, Mr. Right. He comes along, gives his semen sample. The eggs are thawed out. Fertilization happens, and you can both have a child. And the great news is that because you froze your eggs when you were younger, the quality of those eggs are much better. All right. So egg freezing does have a bit of a time limit. I would advise anybody who is 35 and under should who's considering it should come and get that done. We don't really want to do it when you're in your 40s, because the quality of the eggs, like I said, are gonna compromise how well that egg might survive when you actually need to use it. So if you're 35 and under and you're not yet ready to start a family, but you obviously you're very savvy, you're aware that at one point I do want to have a family, come and freeze your eggs. That's really what I'll say. So all our single career women out there.
Okay, so now those are some of the thoughts. But one of the things that Dr. Tambari said was that, important to have, oh wow, time is actually against us. It's important to have an opportunity to have a consultation. And these days, financials are a huge, huge part of what it is, that's causing sort of delay in people seeking treatment, etc., and finding out what they need to do. I want to ask you and sort of push, is there an opportunity for the Bridge Clinic to maybe give people who've come for this webinar, a free cycle, maybe 5 people, maybe 10, I don't know, will it be possible to give them a free consultation, at least to encourage people to come on the webinar, at least people who've listened to it on Doctors on Air who want to, who come in, is that possible?
What you said about the financial aspect is so relevant right now, and of course, we're very happy for everyone to come and join the free webinar, and get the information that they need, but of course, I think definitely that's something that we can look at, we'll probably, maybe something that we'll reveal on the actual day of the webinar, if you join the webinar, we'll have a little look at maybe selecting, a certain number of couples, and offering you, like a free consultation with one of our doctors, just to really help, get you, to that next stage of where you want to be. So definitely that's something that we can definitely look at, just to help, because we fully understand the challenges of everything that's going on right now, in our economy.
For me, I think all I want to do is encourage the more people, the better, to have this opportunity to be able to be one of the lucky few who gets this opportunity to get a free consultation. How can people link onto this webinar? How can they get the link?
So on all of our social media platforms, so either our Instagram platforms, or if you go to our website, which is www.thebridgeclinic.com, or our Instagram handle, which is Bridge Fertility Clinic, and there's a link on there, and you just click on the link and you can register from there. And like I said, we're going to do our best to ensure that confidentiality is present for the registration, so they can really get the most out of the webinar.
So Dr. Tambari, do you have any last words for our listeners?
Yes, I would say that, a lot of couples have been, they've achieved their dream of having a family through Bridge Clinic. And so I encourage them to, come in. We're a very religious society, and I know we pray a lot. 7 a.m., everybody's on a prayer call. After the prayer call, walk into the clinic. And I believe that your faith and our expertise can work hand in hand, and you can get what you want.
Thank you. Dr. Toyin?
I just want to encourage everyone to join the webinar. So September 16th, 10 a.m., it's open to everyone. And, this is not just, to people in Nigeria. Bridge Clinic has a lot of international clients. So if you know people who are based, internationally, let them also, direct them to the link to the website and let them join the webinar as well. And like I said, on the day, we should reveal some good news for a certain number of couples as well.
Thank you. Thank you very much. Thank you for watching. Please like, share, and subscribe for new video updates.